Imagine that you are in charge of an intensive care unit in a large hospital. Your city is experiencing unprecedented numbers of COVID-19 patients because administrators at your state's flagship university decided to hold in-person classes rather than to switch to an entirely online format. Your ICU has been assigned the task of exclusively treating patients with the most severe cases of COVID-19, and it is your job to choose which of them will receive ventilators and which will not. In many cases, it is your job to decide who will live and who will die. On Monday morning, you find that your ICU has one ventilator available. 2 patients arrive at the hospital at exactly the same time. Greg is 23 years old and, other than having a nasty case of COVID-19, is healthy. Dan is 70 years old and is suffering from severe congestive heart failure, severe chronic lung disease, and severe cirrhotic liver disease with multi-organ dysfunction. You're prohibited by the U.S. Civil Rights Office from discriminating solely on the basis of age, but it still seems obvious to you what decision you should make. You give the ventilator to Greg. Did you do the right thing? Well, to figure this out, let's look for a principle that could explain and justify your choice. One such principle is as follows. Distribute ventilators in a way that maximizes expected years of life. Call this the life maximization principle. If the life maximization principle is true, that would explain and justify why it was right to give the ventilator to patient Greg. They were going to live longer. Now we have a principle, but is this principle a good principle? In order to evaluate it, one thing we need to know are its implications for the real world. In other words, what are the consequences of accepting this principle? It's sometimes hard to predict all of the implications of a principle from the armchair, and one thing we can do is ask other people who have lived experiences that are different from ours in ways that are useful for the question at hand. In this particular situation, suppose that you call your friend Gretchen, and she's a hospital administrator down in Georgia. You explain your situation to her, and she shakes her head and tells you that your principle will not work. You ask her why, and she tells you the following story. So last Monday, a patient named Samantha arrived in Gretchen's ICU. When Samantha arrived, there were no more ventilators available in the hospital. Most of the patients in the hospital were younger than Samantha, except for David, who happened to be Samantha's age. David and Samantha were alike in all medically relevant respects except for one fact. Samantha is female and David is male. In the United States, females live, on average, 5 years longer than males. So Gretchen tells you that the life maximization principle would have directed her to kill David by unhooking him from his ventilator and giving it to Samantha. But it seems to her, and you agree, that unhooking and killing David to save Samantha is the wrong thing to do. Because of that, the life maximization principle doesn't seem like it could be the right principle after all. Gretchen offers you another principle that she has been using successfully, or so she says, in her hospital. It is wrong to kill an innocent person to prevent another person from dying. And she calls this the Antimurder Constraint. You thank Gretchen for the consultation, you hang up the phone, and reflect on this new principle. So first, you realize that the anti-murder constraint doesn't explain and justify the first decision you made, giving the ventilator to Greg rather than the much sicker Dan. The anti-murder constraint says nothing about what to do when 2 patients arrive at the same time and you only have one ventilator. For this reason, you decide not to throw out the life maximization principle completely. You decide that you will follow the life maximization principle in all cases except for ones that would violate the anti-murder constraint. But now we have a hybrid principle. Is this principle the right one? You decide to call another of your hospital administrator friends. You call your friend Chester from Colorado. He tells you that he is not impressed by your hybrid principle. When you ask him why, he tells you his story. Chester's hospital used to follow the hybrid principle, but then, one day, he decided to look at some spreadsheets over lunch. He tells you that he noticed that over a period of 3 weeks, there were, on average, 10 prospective patients competing for 5 available ventilators each day. His staff, following his instructions, implemented the hybrid principle perfectly. Healthier patients were given ventilators rather than sicker patients, and nobody was murdered. Everything seemed wonderful until Chester realized that something was wrong. Although there was no explicit discrimination on the basis of class, poverty is correlated with higher rates of cardiovascular risk. And for this reason, in all of the one-to-one competitions between wealthier and poorer patients, the wealthier patients ended up getting the ventilator. And although there was no explicit discrimination on the basis of race, in the United States, race is also correlated with poverty. As a consequence of following the hybrid principle and the random pairings of patients in the one-to-one comparisons for ventilators, Black patients were disproportionately underserved based on their representation in the population in the hospital. The race and class-blind hybrid theory ended up exacerbating existing health inequalities among demographic groups. Now, Chester's solution was to stop doing one-to-one comparisons between patients and instead to use a new system for classifying incoming patients into 4 groups based on a rough assessment of their overall health. Ventilators were then assigned to patients using a weighted lottery. People in the healthiest group were given more chances to get ventilators than people in the least healthy group. However, anyone in a group had the same chance of getting a ventilator as anyone else in that same group. So you thank Chester for his proposal, and then you get off the phone so you can think about this. If we should prioritize the interests of the worse-off members of our society, then Chester's solution is an improvement over Gretchen's principle, understood in terms of a hybrid principle. But if we should maximize overall well-being, then the hybrid principle is superior because it does a better job of making fine-grained comparisons between individuals based on how likely it is that they will survive. So, what's the right answer? Well, I'm not going to give you an answer to this question. I'm not going to tell you what I think the right answer is, although I do have a strong opinion about what the right answer is in this case. Instead, what I want to do is comment broadly on some lessons that we can take from this story that I just told you. One important lesson is that we can learn from the experiences of others when we're asking ethical questions. Other people sometimes have relevant experiences and expertise that we lack. And in these cases, they can help us explore the real-world implications of our ethical principles. Gretchen helped in this way by describing the real-world consequences of accepting the life maximization principle. Other people can also help us see morally relevant features of situations that we might otherwise have missed. Chester helped us see that the effects of a policy on existing inequalities between groups is morally relevant. Now, another lesson that we can take from this story is that people sometimes do disagree about how to answer ethical questions. So in this story, Chester thought it was better to prioritize the interests of the worse off rather than to try to maximize overall well-being. But as we're going to see next week, many philosophers disagree with Chester. Now, disagreement about ethical questions is common, and I want to close this lecture by commenting on this. The fact of disagreement should make us humble about our own judgments, especially about our judgments when we haven't yet subjected them to scrutiny. But it's important not to jump too quickly from humility to relativism or nihilism. The mere fact that people disagree is not enough to show that there are no right and wrong answers in ethics, or that rightness and wrongness is relative to one's culture. In the Odyssey, Homer talks about Odysseus navigating his ship between Scylla and Charybdis, a dangerous monster and a deadly whirlpool. Now, we're in a similar situation, but our task is to navigate between being inflexibly dogmatic about morality and giving up on the project of searching for moral truth altogether. If we go too far towards dogmatism, we will miss out on opportunities to correct our misconceptions and learn from others. But if we go too far in the other direction, we will abandon the project of fighting for justice, fairness, freedom, liberty, dignity, and everything else we rightly hold dear. Over the course of our time together, we're going to do our best to chart a path right down the middle.